Hi, I'm Megan Hoffman, and I am a Level 1 trainer for PCIT and the PCIT supervisor here at Wesley Spectrum. And we're going to talk about PCIT, or Parent-Child Interaction Therapy. So what is PCIT? PCIT is considered an evidence-based therapy, meaning that there's hundreds of research studies that have shown that PCIT is effective for children ages 2 to 7 with disruptive behaviors. So things like yelling, screaming, hitting, big tantrums. It's considered best practices for any family who's experienced abuse. So we know that PCIT can reduce recidivism rates for families who have been physically abusive to their children, even better than other programs. So these families who go through PCIT are less likely to abuse their children in the future than any other program. There's lots of also emerging research about PCIT for lots of other mental health diagnoses, such as autism, anxiety, and others. There are two phases in PCIT. The first phase of treatment is called CDI, or child-directed interaction. In CDI, we're really focusing on the parent-child relationship. So for kids that have disruptive behaviors, this relationship is often strained with the parent. The parent's whole day is spent saying, "Don't do that, knock it off, quit it," and they have no time to have that strong relationship with their child. We implement play therapy techniques and teach the parent how to use these for 5 minutes a day at home. This is the most effective way to have families build that relationship while still making sure that they're not overwhelmed by having to implement something 24/7. We just ask for 5 minutes a day to practice these skills. Parents will continue to use these skills until they master them, so until they use them without even having to think about it. Once parents have mastered those skills, we can move on to PDI, or parent-directed interaction. That's the discipline phase. So we know that children with disruptive behaviors aren't very good listeners. So we make sure we teach parents how to give effective commands and be consistent and predictable. So typical kids listen about 60% of the time. In PCIT, our kids will listen at least 75% of the time within 5 seconds. Some of the key points of PCIT are that the caregiver and the child participate together. So the therapist sits on the other side of a one-way mirror and coaches the parent through an earbud. The parent plays with the child while the therapist coaches them through that live interaction. This is the most effective way for the parent to learn the skills in real time and have support when it's needed most. So when the child is tantruming, the therapist is right there with the parent to support them. We also make sure that the skills are being implemented in the best way possible. We don't ask the family to go home, try it, report back, we'll see how it goes. We make sure that the parents are implementing them perfectly right in real time. Sessions occur once a week for about an hour a week, and it's all data-driven. As I mentioned, the parent has to master the CDI skills before we'll move on to discipline. And all of the coaching that the therapist does is dependent on what the family is reporting and how the family is doing in session. PCIT is considered short-term, but it's not time-limited. So typically a family is enrolled in PCIT for 12 to 20 sessions. However, there's no criteria for them to have to be done after a certain number of sessions. We will continue providing PCIT to families until they feel confident in managing their child's behavior. We do have graduation criteria, and graduation will only occur when the caregiver shows that they can use all the skills successfully. We also make sure that different assessments show that all the child's behaviors are within the typical range, so they're acting just the same as their typical peers. And again, we make sure that the child is listening at least 75% of the time within 5 seconds. We also like to make sure that the parent feels confident in managing all the skills. So I know this is a long quote, and I know it sounds fake, but it really is a true quote from a parent. Before going through the PCIT program, we were at a loss for how to handle our child. We had tried multiple forms of discipline, ranging from timeout to yelling. We didn't want to leave the house. When we did, we would hold our breath the entire time, waiting for an outburst where he would yell, kick, and refuse to listen to us. PCIT is an amazing tool that helped us listen to our child, learn to give him attention when it was appropriate, and how to eventually discipline him in a manner that was fitting to his personality. We would leave each session with a new level of confidence. We no longer worry about going into public with our child. He knows our expectations now, and we use everything we have learned in PCIT on a daily basis. PCIT has become an integral part of our lives and our happiness as a family unit. I will sing its praises to anyone who is struggling with a strong-willed child. The same strength and obstinance that frustrates parents can become a positive in life with the help of PCIT. Thank you.